Go ahead.
All right. Good afternoon. I'd like to talk to you today about shaken baby syndrome. I chose this topic because I see how it can affect a child's life every single day. My son Austin suffers from shaken baby syndrome. He was a victim of this crime when he was only 5 weeks old. The actions of one person will forever shape the way that he lives his life. Today I'd like to cover some important topics about shaken baby syndrome as well as some prevention techniques. I'll be covering some general information, causes, signs, and symptoms, treatment, and prevention. For general information, I'd like to start by defining shaken baby syndrome, which is a form of child abuse in which the violent shaking of an infant causes the brain to move inside the skull, causing bruising of the brain and tearing of the blood vessels. The shaking results in bleeding around the brain, eyes, and spinal cord, as well as neck injuries, bruises, and rib fractures. As you can see in the picture here, it kind of demonstrates how it works. It's also known as abusive head trauma because it can be caused by the violent striking or forceful hitting of a child's head against an object. Now that you have the definition, I'd like to go over some statistics that I found. In North Carolina, between January 2000 and December 2001, they did a study on traumatic brain injuries in children under the age of 2. Throughout the state, they found 152 cases. Of those 152, 80 of them were inflicted, meaning that there was some form of shaken baby syndrome. The average age of those 80 cases was 4 months old. Now, assuming that the stats that they found in North Carolina held true throughout the rest of the country, there'd be an estimated 1,300 cases of shaken baby syndrome every single year. Of those, 1,200 would be to children under the age of 1, and almost 25% of them would result in death. Now that you have the definition and some of the statistics, I'd like to go over some of the causes, signs, and symptoms of shaken baby syndrome. Obviously, the main cause is the violent shaking or striking of a child's head. But why would somebody do that? The number one reason given by people that shake children is because the baby wouldn't stop crying. Now, that's not the only reason. Some of the other factors might be young or single parents, stress, domestic violence, alcohol or drug abuse, as well as they might have had child abuse in their own history. From a military standpoint, some of the stressors that might be caused could be coming back from a long deployment. You come back, you have to reintegrate into the family atmosphere and learn how to deal with children again. Or you leave for one, and then your wife or spouse or whoever it is trying to take care of the kids by themselves in a stressful situation and doesn't understand why things might be going on. Some of the common misconceptions about shaken baby syndrome is that it can be caused by throwing your child up into the air and catching them, bouncing them on the knee, or any sort of rough play. But that's not true. It actually would take a fall of more than 20 feet for a child to incur the same sort of injuries or damages that are caused from shaken baby syndrome. Some of the early signs of trauma in babies might be the baby might have a difficulty staying awake. They might be extremely irritable, loss of appetite, or vomiting. They might not smile or vocalize the way that they used to. In some of the more severe cases, they might have pale or bluish skin, or they might have lethargic eyes, meaning they're not going to track you around the room or follow your voice. They're just going to kind of be staring off into the distance, as well as difficulty breathing, seizures, or swelling of the head. To include the soft spot might be bulging a little bit because of the swelling on the brain. Some of the long-term symptoms for more mild cases would be learning or behavioral problems, physical or emotional growth delays. It might be a little bit smaller, or they might be emotionally inept compared to some of the other kids their own age, as well as intellectual disabilities. They might have a harder time in school because of the damage. In some of the more severe cases, you're going to have things like vision problems or blindness, seizures, cerebral palsy, paralysis, vegetative state, and obviously in the worst case, you're going to have death, which might not happen right at the time of the injury. It might happen later on because of the damage that was caused due to the shaking. Now, although most of these symptoms are irreversible, there are some treatments out there for children with shaken baby syndrome. Some of the treatments from a medical standpoint are going to be cooling mattresses to help prevent or to help control the body temperature, oxygen treatments for the difficulty breathing, CT scans or MRIs to get images of the brain and the body to find out just exactly what damage was done. In cases where there are seizures or swelling of the brain, they may have to use medication to help control those. And if the brain continues to swell, they may have to resort to things such as surgery to install a shunt to try and relieve some of the pressure. Later on, after they get out of the hospital, they're probably going to have to go through some form of therapy, whether it's physical therapy to help them walk or crawl or sit, or occupational therapy, which is more fine motor skills, using pencils, writing, putting puzzles together, things like that. Or speech therapy, which is not just to help them speak. It might be, if they're having difficulty eating, help teach them how to manipulate food with their tongue or swallow. Now, as I said earlier, the number one reason that people gave for shaking their child was because the baby wouldn't stop crying, which is why prevention starts with the individual. Never shake a child. Avoid holding your child during arguments. If your child is crying uncontrollably and you start to get frustrated or overwhelmed, set the child down, walk away and take a break. Drink some water, take a couple deep breaths, call a family member, a friend, or a pediatrician to get some emotional support or some other ideas about what to do. Beyond that, it goes to the relationships that you have with other people and the relationships that your child has with other people. Make sure that the family member, friend, caregiver, babysitter, whoever it is a trustworthy person, someone that you trust completely to take care of your child and will be able to control their emotions in a situation where they may not understand why the child is acting the way that they are. Then it goes out to the community. Inform your friends, inform your neighbors, inform the school systems, whoever it is, about the risks of shaken baby syndrome and how it can affect a child's life. If you ever suspect that child abuse is going on in a home, call the police or child protective services immediately to get someone out there. Let them do their job and try and rectify the situation. If nothing's going on, nothing's going on, but it's better safe than sorry. And then it goes on to society. There are shaken baby syndrome prevention and awareness programs out there, and we need to help support them, help bring awareness of those programs to other people so that the young parents or the people under stress are able to better cope with those issues. One of them specifically is called the Period of Purple Crime. It's a program out there to help teach parents and caregivers how to deal with a child that is crying uncontrollably and help them learn coping mechanisms so that they also can prevent shaken baby syndrome themselves. Now, as you can see, prevention is obtainable, and I hope I was able to give you some good information about shaken baby syndrome so that you too may help in the efforts to prevent further cases of shaken baby syndrome from happening. To quote one of the great authors of our time, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. Now, this may be a simple quote from Dr. Seuss' character, the Onceler, but the message says it all. Thank you.